All right, everyone, we're going to talk about the art line setup and recess today. So before you get started with an art line setup, we have to make sure we have everything that we need. So obviously that's going to require the physician to put in an art line, so in order for that. But anytime they're doing that, we're going to go ahead and get all of our supplies. So this is what we call the flow track sensor. It's over in the recess pixels to the bottom right. You're going to have that, 1,000 bag of normal saline, and a pressure bag. This is our recess clip. You can find them in the top drawers at the heads of every bed. You should have one at the head of every bed. And then also we're going to need this cord, which goes to the actual art line. It'll attach to the flow track sensor. So just to begin, so I've already got my fluids in the pressure bag, but you'll notice that I don't have it filled up yet. That's because if you go to spike this bag while it's filled up, you can create air bubbles, which are going to give you a false reading on your art line. So it's really important to make sure that, even more so than pump tubing, that this has absolutely no air bubbles in it whatsoever. So I'm going to open this up. I'm going to show you what it looks like. So this is our sensor. People always, I think the most common mistake is that they get it upside down, and that's because it seems logical that the patient side would go down and then the bag side would go up. But the truth is that just the way this works, we have to have the Edwards. Basically, if you can read Edwards, that's facing right side up. And the way it works is you have to have it in this position. So this tubing on the bottom will go up to the bag, and the tubing on top will go down to the patient. So that's just how that works. So what we're going to do first is we're going to spike our bag. So I'm just going to kind of pull this up a little bit. Again, I would typically be wearing gloves if this was for a patient. I like to get everything untangled. So you want to make sure you keep this extra clean. There we go. Alright, you're going to squeeze the chamber, get some water in there. Alright, so I'm going to go ahead and attach my flow track sensor to the, to the clip here. There you go. It's actually going to sit down right there, in between these little things, in between the arms here. Alright, so again, I actually just made my own mistake. I put it upside down. So again, you're going to want to make sure you can read Edwards, so just make sure you do that before you, attach it to the patient or anything. So we're going to try to get as many air bubbles out as we can. Now there are 3 points of basically like this being open to the outside on this machine. So whenever you do this, you want to take a look at where your little points of access are. So we have one point here that's directly attached to the sensor. We have a second midpoint. So I'll kind of show you real quick. This is on the patient tubing. It always comes out super tangled. Okay, so our midpoint is here, and then our patient point is here. So all 3 of these points are technically open to the outside world right now. So we use our little switches here to make sure that we close them off. So I'm going to set this right here. Alright, and so right now how this switches, when it's pointing towards an area, that means it's off to that area. So right now it's off to the outside world. So whenever we do this, again, we're going to look at this tubing because this is the tubing that's connected to the bag. We have our sensor we have our clamp wide open. This blue tab is what you're going to pull for it to come out of here. So first we're going to turn this off to the patient tubing. So now the water is going to flow up and out here. So I'm going to pull this pull this, and it's going to shoot out of the side here. So the reason I do this in the 3 different steps, you'll see some people who just go all the way through, is because it creates less air bubbles, and if you do get an air bubble up here, you don't have to go through the entire tubing. You can just go halfway through it and get rid of it. So I'm going to check this tubing first, make sure I have absolutely no air bubbles. It's very important. And I'm good, so we don't have any air in it. So I'm going to turn this off to the outside world once again, and then I'm going to go ahead and prime my for the second time, to my patient tubing. Okay, so I'm basically going to turn this off to the patient, so it's off to this. and it's going to shoot out of this area. So now I'm going to pull the blue tab again. It's just opening up that area inside of the sensor. And there it goes. It's coming out. So again, I'm going to look for air bubbles, make sure that I have no air in my tube, and we're good to go. So last but not least, I'm going to do the exact same thing for the patient. And then this is not going to be attached to the patient. This is going to be just like I am now, holding it. And I'm going to pull it, and it's going to come out of here. So now our tubing is primed, and we have absolutely no air bubbles inside the tubing. You can always double check it again. But we have all of our flow track, our tabs off to the outside world right now, so we're good. So what I'm going to do now is I'm going to fill up this bag, the pressure bag, until it gets to the green tab on here. So once we see green, we know we're good. And the reason, some people talk about using 500 bags for this. The reason we don't use 500 bags in this hospital is because we don't have 500 pressure bags. So we just use the 1,000 milliliter saline. Okay, so I see green. So we're good. And we're basically ready. We're primed, and we've got this. I've got the bottom of the bag hanging out. It's not a big deal. To be honest, the main thing you want to be sure of is that you don't pinch the tubing inside the bag. So if this bag was up here and the tubing was pinched inside of it, you could actually cause a false reading as well. So, just kind of keeping that in mind. But it's okay that it's sticking out of the bottom. So now that we have this primed, we have it set up, we're going to go ahead and attach it to the wiring that I talked about earlier. So we're going to first admit the patient, new patient. So typically this is the screen you'll see, but as soon as you plug this in, it's going to pop up, and you're going to have a question that's going to ask you if it needs to be zeroed. Well, right now we don't have this hooked up to anything, so we just wanted to have this wiring out. Okay. So now I'm going to hook this up. And the reason I'm going to use the red port, you can technically in recess you can use either port, but the red port is good to use because in the ICU they might be hooking this up to another sensor. So it's just better the Artline, think Artline, red, blood, you're going to hook it up to the red port. So now it's hooked up. One thing I also forgot to mention, that you should do this before you hook the flow track sensor up to the patient, before you hook up the tubing, is inside of this flow track container you have two little blue ports, and what you're going to do is you're going to change your plastic clear ports out for these blue ones, because these have holes in them and you don't want those holes to either cause an infection or basically mess up your reading. So you're going to be as clean as you possibly can, but first you're going to turn the first one off to the patient. You're going to take it off as lightly as possible. I'm going to prime it just for that little thing, just to get all air out of it. And then without touching the blue, I'm going to just lightly put that on there and screw it on. And then I'm going to do the same thing for the other clear thing. So at this midpoint, I'm going to change out this piece with the hole in it. So I'm going to turn it off to the patient. And I'm going to, I know I'm touching it right now, but typically you would not want to touch it with your hand like this. I'm going to take this off. I'm going to prime it. And then using clean hands and not touching the inside of this, I'm just going to lightly put it on and screw it on there. So now we're good. So now none of these have holes. The only hole is going to be to the patient that's going to be connected to their Artline pretty soon. So now we can go ahead and start zeroing as we need to on the screen. So this process is really easy, actually. So it's going to pop up. It's going to ask you if you need zeroing. So you're going to say yes. The first thing you want to check on here is your label and make sure that you're in Artline. Because if there was a patient here before and we didn't change the settings, they could be in an ICP line, they could be in a CVP line, it could be different. So just check that, make sure it's in Artline. Sometimes you'll have to check your scale if the settings are off, but typically it'll be automatically in the scale of 0 to 200, which is normal for blood pressure to be in for your art line. But if it was in something else, you would want it to be about there, 0 to 200, so you would just click that. So going back to your main, this is where you're going to zero. You have two options, 0 all or 0 cal. Again, in recess, it's usually okay to hit 0 all as long as all you have hooked up to this machine is the art line. But just to be safe, do 0 cal because that's only going to zero the art line. And then to make sure that we've zeroed it, I'm going to come back here to this blue tab and I'm going to make sure that all of this is off. So we're off to the world. So this is open. And I'm just going to wait for that line to even out again because I'm touching it right now. It's going to move a lot. So I'm going to let go of that. Okay, I'm going to hit 0 cal again. And then when I see that spike, because I pulled the blue tab, that means that I'm zeroed. So we're good to go. So now I can just hit menu or home menu. And whenever we hook it up to the patient, it's going to automatically be zeroed for that patient. Last point is when you do hook it up to the patient or whenever you're zeroing it, the important part for this, and this is extremely important, is that it's actually at the level of the patient's heart. So whenever you're doing this, if my patient was here and this was his heart, I would want to make sure that this was in line. So I can either like get it right up to him or use my arm to kind of measure, but you want to make sure that this sensor right here is at their, what we call the phlebostatic access point. So it's going to be right there in line with the heart. But if you move the bed down when you're done, or if you've ever moved the patient to CAT scan, you always have to re-zero it and put it next to the patient's heart.